Oi Cik, dengar suara dia ni. Duduk kan. Cik kak. Salam sobat. Dengar tak? Jelas ke jauh ke macam ni?
Yang kau jelas, yang Danish tu korang.
Cuba je kak ni.
Hello. Test. Test 1, 2, 3. Nampak tak?
Gelak kan. So, try aku tak tahu.
Test. Jelas Haji? Tadi jelas tak suara? Okay.
Kalau aku jelas tak kalau aku? Okay dah.
Bila bertahan rentak di kalbu, hasrat yang tersirat semakin kuburu. Bila bergema naungan gempita, harapan bernyala, nadiku berganda. Gemuruh jiwa, semangat membara, dari puncak ingin ke angkasa, berkalungkan bintang berkelipan, menyerlah jauh dari yang biasa. Bila bertalu rentak di kalbu, hasrat yang tersirat semakin kuburu. Bila bergema naungan gempita, ke angkasa.
Boleh tukar lagu tak?
Menyelah jauh dari yang biasa.
Aku nak record lagu boleh? Ha?
Lagu apa?
Kos tulis Habibi Albanian Remix.
Sorry, tak ada lagu pelik-pelik.
Tak pelik lah dah. Pasal lu, try lah.
Lagu apa?
Tulis Habibi. Tu Albanian Remix tu, bawah. Tu. Tu lah. Thank you.
Utav alle gjettetimer vet en utgang, Habibi. 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 Gemuruh jiwa, semangat membara, dari puncak ingin ke angkasa, berkalungkan bintang berkelipan, menyelah jauh dari yang biasa, menyelah jauh dari yang biasa.
Pahit kendir hidup dan pengorbanan terpaksa dihadapi demi kejayaan. Terdidik sejak mula tabah berusaha, tanpa cuba melangkah tak kemana. Di mana kau berada, pencapaian tak tiba dengan mudah.
fikirkan kemenangan, kau hampiri kejayaan. Engkaulah apa kau pikirkan, terkandung dalam pemikiran. Berpikir boleh melakukan, pikirkan boleh. Percaya apa kau lakukan, tabah apa kau usahakan. Bertindak atas kemampuan, kau boleh. Jika kau pikirkan kau boleh, kau hampir boleh melakukan. Jika kau fikirkan ragu-ragu, usahamu.
Faiz boleh jalan.
Jika kau fikirkan kekalahan,
Kau nak masa lagi? Tak lah, aku ingat belum start lagi. Gini lah 95 minit, 95 minit start. Fairul dah ada Fairul? Fairul ada tak? Sekejap. Fairul.
Simo.
Oh, Fairul tak ada.
Dengar aku clear tak?
Clear.
Okay.
Ni aku punya speaker tu ni. Berapa minit start lah? Dan satu lagi makluman, aku nak buat hari Sabtu minggu depan.
Je, aku lupa nak cakap.
Ya?
Sekejap. Marah. Look, satu bulan 8 bulan 1, sorry. Aku memo tu, muat on demand.
Oh ya?
Kau sesi 2 je Pri, kau punya muat.
Siapa yang cakap tu? Aku tak ingat. Aku tak tahu, aku tak pasti.
18.1
Kan, ni je meh.
Tak tahu
Aku lagi bisang lah kan. Tarik exam lah yang muat.
Sebabnya aku tak kan nak buat minggu ni macam apa? Lecturer tak ramai yang boleh join.
Betul. Kalau nak ni pun dia macam hari Jumaat petang tu jugalah.
Kira Jumaat minggu depan lah, 7 hari bulan 1.
Yep. Itu je lah kot. Sebab 8 hari bulan tu dah ke aku mungkin kira petang tu mungkin lah kita orang nak drive pergi ke nilai tu siap-siap.
Okey, 7 hari bulan 1 pukul 2.30 petang. Okey tak? Okey Asyuk?
Aku pula. Tak tanya puan lah. Sebab kita tak boleh proceed yang 8 bulan 1 tu je lah yang aku pasti. Kena cakap dengan puan enggak?
Nanti aku nak beritahu macam Aliyah dulu.
Okay, aku start Aku start sekarang.
Nak start tapi ada semua orang ada ke tak ni?
Yang present penting. Semua present dah ada.
Nurin ada, Fikah ada. Jalan dulu lah kot.
Fizu tak ada.
Iwan ada. Fizu tak ada. Oh iya ke? Syafiqah ada. Alan. Syami.
Masih Fizu je. Buku sian.
Wait, Aisyah pun jap. Aku call Aisyah jap.
Aku tak Aisyah tak join. Aku ganti dia MC. Hari ni dia ada benda nak buat.
Okay.
Biasa. Ya.
Kita ada kelas kan? Dah apa belum? Oh. Ya, boleh masuk kan ni? Tak ada apa-apa. Oh, ni. Oh. Nilai kan? Nilai kan? Belum. Oh ya. Ni.
Berarti kau sama chat. Ya, aku tak tutup mic tu.
Best. Dia pun pakai MB.
Baik, boleh start lah.
Okay. Bismillah. Okay. Assalamualaikum warahmatullahi wabarakatuh and good morning to our highly respected head of Department of DU, Puan Ida Maria, our lecturers, Puan Rabiatul Adawiyah binti Abdullah Zawawi, Puan Mansarah binti Kamarudin, Puan Jamaliah Jaafar, and fellow student of Polytechnic Shah Alam. First and foremost, I welcome all students from DU to this fantastic anatomy webinar. Before we begin our webinar, I would like to invite Ahmad Najib to recite the prayer.
Al-Fatihah.
Kita tak ada kan?
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma innaka lakhalaqun azim, innaka sami'un alim, innaka laghafurur rahim, innaka rabbul arsyil azim, innaka al-barrul jawadul karim. Ya Allah, Engkaulah yang mempunyai segala kepujian, Engkaulah yang berhak menerima segala kepujian, Engkaulah yang berhak menerima segala kesyukuran, Engkaulah yang memiliki segala pemerintahan, di tangan Engkau segala kebajikan, kepada Engkaulah kembali segala urusan. Ya Allahumma ya Karimu ya Rahim, Ya Allah ya Tuhan kami, cucurilah rahmat dan rahimmu ke atas majlis kami pada hari ini, iaitu webinar Funtasy Anatomy yang diadakan pada hari ini. Berkatilah ia dari awal hingga akhirnya. Kami juga memohon perlindungan darimu dari segala perkara yang boleh mencacat celakan majlis kami, dan daripada segala perkara yang melalaikan kami dari berbuat taat kepadamu. Kepadamu jua kami serah segala urusan kami. Rabbana alaika tawakkalna wa ilaika abana wa ilaikal masir. Rabbana atina fid dunya hasanah wa fil akhirati hasanatan wa qina azabannar. Sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa sallam walhamdulillahi rabbil alamin.
Amin amin rabbal alamin. Thank you Ahmad Najib. Okay, now with much honor I would like to call upon Madam Ida Maria to say a few words. Thank you, Madam Ida Maria. Without further ado, now let's start. Oh, sorry. Boleh skip kot. Puan Ida tak ada kan?
Boleh.
Without
Jalan.
further ado,
Jalan.
let's start now our webinar. Faiz will be taking in charge for now. Hi and good morning to everyone. Firstly, I would like to thank our MC. Thank you, Aisha, and welcome to everyone for investing your precious time with us. I am super excited that you guys are here. I cannot wait for all the amazing conversation that we're gonna have today. Let me introduce myself a little bit. My name is Faiz. I'm a diploma graduate from POLITEKNIK Salahuddin Abdul Aziz Shah, but apparently I haven't had my graduation due to pandemic. But I finished my diploma of electronic medical this year. I'm also currently studying in the same institution again, phase A, to pursue my degree. Okay, enough about me. I will brief a little about our webinar. I will be moderating this session. So just a quick note, this session will be recorded and will be streamed live on YouTube. So please be aware of it. If you have your camera on, make sure to turn it off. And if you don't want your video to be shared for the social media later on. There are 6 topics that will be presented by our panel, which are blood and cardiovascular system, nerve and muscle system, respiratory system, reproductive system, urinary system, and endocrine system. Each of the session will take about 15 minutes. After 2 sessions, we will have a little game which will be held on Kahoot. And after 4th session, we will have an energizer. We will also be having a quick Q&A session after presenter done with their topics. Now, without further ado, we will turn the time over to Nurin Akila and Siti Nur Afika. Please welcome them.
Thank you, Faiz. So, Assalamualaikum and very good night to all. My name is Kunran Akila and my partner was Siti Norfika binti Mustafa. So, today we are going to talk about our topic, which is blood and cardiovascular system. So, I will share to you guys with my slide. Alright. Okay, so you guys can see my slide or not?
Yes, but can you make it a full screen? Thank
Yeah,
you.
sure. Okay, so today we are going through about blood and cardiovascular system. So today we are dividing into blood and cardiovascular. So I will explain further about blood and my friends Afika will explain further about cardiovascular system. So this is our presentation outline, and today's discussion we are going to talk about introduction of topic. This is under this topic, the disease system and current technology used. So we all know that blood are divided into 2 categories, which is RBC, that is red blood cell, and WBC, white blood cell. So our prime point for blood disease is white blood cell, where it will bring us to explore the disease under it, which is leukemia. So, leukemia is a blood cancer caused by a rise in the number of white blood cells in your body. So, how can leukemia happen in your body? So, when I'm doing some research, I know that leukemia happen when there is undetermined combination of genetic and environmental factor that can lead to the mutation in the cells that make up the bone marrow. So, the extra white blood cells that don't work right. So, this is the some fact that I found where men are at higher risk than women, where men are 31% more likely to be diagnosed with leukemia than women, and their rate of dying from leukemia is around 30% higher than female victims. So as you can see the pictures beside this is the difference between the normal blood and the leukemia, where this is the leukemia cells, as you can see, the blue one, and the normal blood is like a stable one where there is neutrophil. Neutrophil is one of the white blood cell type, and this is the red blood cells. Next, we are going through the leukemia symptom, and this is kind of the leukemia symptom that you might have, such as weakness or fatigue, pain in your bones or joint, weight loss, night sweats, vomiting, headache, and shortness of breath. So, for my recommendation, if you guys have this kind of symptom, I recommend you to go for the checkup at the hospital or the clinic that near to you. So, this is how leukemia happen. As you can see, this is the bone marrow where the leukemia happen. In the bone marrow is like a sponge in our bones. So, there is a hematopoietic stem cells that have the myeloid and lymphoid, which is it was a white blood cells. And if you have leukemia, one of these blood cell types begin to repeatedly multiply in an out of control manner. So this type of white blood cell will grow and grow. And these abnormal cells called leukemia cells begin to take over the space inside the bone marrow. So in your bone marrow, they will full of the white blood cells, then the red blood cells. They crowd out the other normal cells types that are trying to develop. So that means your red cell will be decreased and the white blood cells will be increased. And this is the current technology applied to cure the leukemia, which is the bone marrow transplant. It also called a cell transplant, or more specifically a hematopoietic stem cell transplant, used to treat certain type of cancers such as leukemia, myeloma, and lymphoma. So as you know, as I just talked before, myeloma and lymphoma is just a type of white blood cells. They fight pathogens, which are the virus and bacteria that can make you sick. These cells help replace cell damage by the cancer and also let your body recover faster from intense chemotherapy and radiation treatments. As they mature, blood cells change into three types of cells your body needs, such for white blood cells that fight off illness. So that's all from me then, but I will give you a link to the chat so that you can go through more about bone marrow transplant, so that you can see the video how the bone marrow transplant going on. So I will pass the slide to my friends, which is Afika.
Okay, Assalamualaikum. Okay, my name is Ituna Afika. I will talk about the cardiovascular system. What is the cardiovascular? The cardiovascular system, sometimes called the blood vascular. It is an organ system that allows blood to circulate and transport nutrient, oxygen, carbon dioxide, hormone, blood cell, and cell in the body. The cardiovascular system consists of the heart, blood vessel, and blood. For the heart, it is a tube to pump muscle and channel blood throughout the body. For the blood vessel, there are three types of the blood vessel: arteries, veins, and capillary. For blood, there are two circulatory systems in the body: the systematic circulatory system and the pulmonary circulatory system. Under this topic, we are going into heart attack disease, since this is one of the most dangerous killer for cardiovascular. Heart attack happens when a part of the heart muscle does not receive enough blood. This can occur due to blockage, tear in an artery around the heart, or if the heart requires more oxygen than is available. This is for the heart attack symptom. Symptom will vary depending on the specific condition. Before slide. This. Okay. Symptom will vary depending on the specific condition. Some conditions such as diabetes or hypertension. However, typical symptoms of an underlying heart attack issue include chest pain or discomfort, feeling lightheaded, pain or discomfort in the jaw, neck or back, pain or discomfort in one or both arm or shoulder, shortness of breath. This is a symptom that often happens to heart patients. There are still many other symptoms, but I tell that is often present in patients. Next. There are several factors that can cause clot artery. The factors are smoking, high cholesterol, high blood pressure, no exercise, and unhealthy diet, diabetes, and obesity. If you are a man and have an increasing age, you are at higher risk for heart disease. Family member who have a history of heart disease may also increase your risk. Okay. For people who have had a heart attack can reduce their chance of developing cardiovascular problem in the future by engaging in the following: controlling blood pressure, control cholesterol, reduce blood sugar, and others. Make regular health checkup to make sure there are problem or not. If you have any health problem, immediately see a specialist. Next. The current technology apply. There are some of the technology diagnose a heart attack. Doctor will diagnose a heart attack based on sign and symptom. Okay, in cardiac treatment, it should use current technology as it allows doctor to determine more easily whether patient need invasive procedure to clear clogged artery, and if non-invasive only need effective drug-like treatment. It can provide information about the blood flow in patient heart and determine whether the patient should proceed with a more invasive heart test based on image collect. Okay. Using data capture by CT scan, it produces a 3D model of the patient heart and use deep learning technique to predict the effect of any blockage. Alright, I guess that's all from me. Before I forget, for more detail of the heart flow, I have prepared a YouTube link for you all. So I will put in the chat for the YouTube link. So that's all.
Thank you so much to Kunurin and Afika for giving a valuable insight on blood and cardiovascular system. So with that, we will go ahead and to take some time for the audience to ask any question to them. And okay, thank you for the audience. Okay, now we are entering the second session. Please welcome Ami and Danish.
Body. Can you see it? The start. Hello?
Yes, Ami. You can see it, but then can you make it to the full screen, Ami?
Okay, Assalamualaikum and good night, good evening to everyone. My name is Amir and this is my friend here, Danish.
Hi.
Oh, we're both from BU3A.
Okay, today
Wait, korang,
we are going
korang
to
ada
talk about
pasang kipas
muscle
eh?
system.
Ada pasang kipas eh?
Okay.
Today we
How about
are
now?
Lain korang sekat-sekat tu. Ke lain aku sekat?
Sekat-sekat.
so today we are going to talk about the nervous and muscle.
Nak
And
Boleh
muscle
borak
system.
pula.
I will present about nervous system.
dengar. Dengar tak?
Boleh dengar loud and
Hello?
clear. Boleh dengar.
Line slow.
Tak apa. Sambung je. Proceed.
Masih ya. Okay.
Okay, we continue. Today we are going to talk about the nervous and muscle system. I will present about nervous system and my friend Ameh here will continue about muscle system. Nervous system. Nervous system consists of central nervous system or CNS and peripheral nervous system PNS. CNS contains our brains and spinal cord, while PNS contains somatic and autonomic. For instance, if we were to look at this human anatomy on the right on the screen, to differentiate between CNS and PNS clearly. So CNS is actually here and here, while the nerve that is connected to the spinal cord on the left and the right is called the peripheral nervous system. For autonomy, it's actually divided into two sections, which are sympathetic and parasympathetic. So the parasympathetic nervous system restores the body to a calm and composed state and prevent it from overworking, while sympathetic, on the other hand, prepares the body for fight and flight response. Fun fact: human brain contains about 100 billion nerve cell neurons. Each neuron is connected to other neurons. Next slide. Okay, talking about neurons, here are some examples of motor neuron structure. What are they and what they do? There are three types of neuron, which are sensory, motor, and interneurons. They are fundamental unit of the brain's and nervous system. They are responsible for receiving sensory input, sending motor commands to our muscle, and last but not least, for transforming and relaying the electrical signal at every step in between. Okay, neuron. What is a neuron? The neuron is divided into three parts, which is dendrites that acts as an input, cell, body, and axon, which is an output. Axon contains myelin shield, which surrounds the axon. Swan cell, which form the fatty myelin. Nodes of Ranvier, which the electrical signal jump on it. We see the animated image over here. And lastly, the axon terminal, which is the output. Here is 1 minute video of how neurons working.
Dengar tak dia punya ni?
Kita masuk.
Amir, video kau memang tak berbunyi
Itulah nak cuba cari. Sekejap cuba sekali. Oh, include computer sound. Okay, kau nampak. Okay.
Nanti geng, kalau macam ada apa-apa soalan untuk diorang presenter ni, kau bagi tahu aku dulu lah, sebab aku takut nanti kalau waktu webinar tak boleh interrupt lah. Aku je yang nanti bagi tahu diorang. Boleh tak?
Boleh.
Boleh.
Amir better kau off mic kot sebab bagi lagi jelas kau kosong.
Okay. Okay. Okay, that
Amir, your mic is off, Amir. Amir, you need to unmute. I think so.
Okay, we have now it's my turn to present about muscle system in our body. We have about 650 muscles in our body. They are divided into 3 categories, which are cardiac muscle, which is our heart, muscle, which is our liver or pancreas, and skeletal muscles such as our biceps. Now let's test our knowledge. What is the biggest muscle in our body? Gluteus maximus, which is located at our butt. What about the smallest muscle? Stapedius, which is located in our ear, in control of the balance. What about the longest muscle? Sartorius, which is connected from our hips to our knee. And the next is masseter, which is the muscle in our jaw. It can have about 90.5 kilogram force. So that is our strongest muscle. Now this is our muscle. As you can see over here, there is a tendon, bone, muscle. This is called skeletal muscle because it wraps around our skeleton. Now if we were to zoom in into the muscle, this is what it looks like. There's a muscle bundle, vesicle, then and then we got myofibril, sarcomere, and in the sarcomere we got Z-line and actin and myosin. If you want to see any change in the sarcomere, we can see a differ if we try to flex our muscle. If the muscle contract, the Z-line in the sarcomere over here, it come closer together, and vice versa.
Okay, now let's talk about the disease of the nervous system, Alzheimer's. It's a neurological disorder that causes brain cell to die slowly, which causes the brain to shrink. This causes memory loss, thinking skill, and the behavior of the person. If it's enough, the person is unable to do their daily tasks normally. Secondly, we got muscle dystrophy. It is a group of inherent disease that damage and weaken your muscle over time. There are many variables of muscle dystrophy, but most of them live for 16 to 20 years expectancy.
Both of these diseases are treatable but not curable. Till nowadays, they did not release any cure for muscle dystrophy. But fear not, there is one cure that allows us to modify our gene. It's called CRISPR. Clustered regularly interspaced short palindromic repeats. It was found in December 1987 and scientists start doing it on 2000. It is a powerful gene editing tool. It can modify, edit, remove, and including correcting genetic defects such as Alzheimer and muscle dystrophy. Here is a 1 minute short video of CRISPR and how it works.
CRISPR-Cas9 is a novel molecular tool modified to allow precise gene editing. CRISPR, often referred to as the gene scissor, can cause targeted double-strand breaks in a specific sequence of the genome. What are the main components of CRISPR-Cas9? First, there is the Cas9 protein, which can unwind the DNA and has also two domains with a nuclease activity, hence it can cleave the DNA double strand. The second component is made up by RNA, the tracer RNA, which is bound to the Cas9 protein, and the CRISPR RNA, which is specifically designed to hybridize with the region of interest, are covalently fused together, and this is called guide RNA. The CRISPR-Cas complex searches for the sequence of interest until the guide RNA hybridizes with the DNA. When there is a PAM sequence downstream of the target region, the nuclease domains become active and create cuts. That results in a double-strand break, which is repaired in an error-prone manner, causing mutations and most likely also the gene knockout.
Amazing, isn't it? This means we can cure any genetic disease, or maybe not a disease at all, such as our height, weight, and IQ. But it is a forbidden in Islamic medical that forbid modifying gene without any reason and needs. Here is a chart on CRISPR patent application. This chart gives information about how many people applied for CRISPR patents from 2001 to 2019. A patent is an ownership or license for you to apply. According to the chart, there are upward trends from 2011 to 2017. Although it stopped going downhill from 2017 to 2019, overall scientists start to realize the CRISPR and CRISPR evolution in curing genetic disease. This is our reference if you want to do some research on the specific topics. That's all from us. Thank you. If you have any question, you can ask directly.
Thank you so much to Amir and Danish for enlightening and entertaining presentation. So now, actually I have one question about this CRISPR patent. We can see on 2015, is it? It's going downside. Is there any bad side effect if we apply that to the human? Is it? Can you like explain to me bad side effect if we apply that CRISPR patent to human? Is there any bad side effect?
CRISPR, almost all medical assignment always have bad effects on human beings. Even though for fever, there is always a side effects. Especially CRISPR, when you start modifying genes, we do not know what happens. You need to go through it. But there's some hope for people who have Alzheimer and muscular dystrophy.
Tak apa, nanti aku tanya balik soalan tu. Aku tanya pasal kan ada yang macam downside kan, orang kurang apply kan CRISPR patent tu. Orang kurang guna
CRISPR
kan.
patent ni bukan. Patent ni adalah
aku nak tahu je kesan buruk kalau dia kan ada kesan baik dia. Apa kesan buruk kalau kita tukar genes?
Bukan, patent ni bukan CRISPR punya patient. Patent ni orang yang buat lesen untuk untuk start investigate pasal CRISPR, sebab CRISPR ni bukan official. Patent ni macam surat lesen. Sebelum kita nak buat satu contoh kita nak buat projek FIP kan, kita nak buat lesen lesen tu patent lah tu.
Okay, thank you so much. Okay, so now we will open comment for question. Okay. Okay, we are done with 2 sessions for now. And now, as I told you guys before, and now we will have a Kahoot game. The games for the link. Quiz bukan games
Quizzes.
Okay. Sorry. Okay, sorry, Okay. We will have some quiz. The link for the quiz will be given on comment section. Someone hantar kat Azmi background tu Funtasy Anatomy.
Aku
Dia tak ada.
share kod
Kau share screen je tak?
game.
Kau share screen je.
Ada tak?
Okay. Korang nak test dulu ke kahut ni?
Quizzes Faiz, quizzes.
Quiz ni. Tak, ni cakap dia nak test dulu terus ke?
Test.
Test Korang masuk je aku seorang kan.
Ni apa, kalau test nanti dia apa ganggu tak? Dia punya macam kan keluar result tu nanti.
Oh,
dia ganggu.
Tak apa, nanti aku buat baru je lah. Just copy soalan je.
Okay.
Nak main ke ni?
Main.
Test, try masuk tu.
Sekejap, apa dia punya link?
Azmi, share link juga dekat komen nanti.
Better share link dan
Pergi abang quizzes. Jumpa juga tu.
Nah, marah kau tu?
Okay, tak apa Azmi. We will start the game now. Start ni tak apa. Ni just test je.
Main sama dia. Dia lagi cek ni, malu kenalan kita tak kenal itu nak.
Tak ada suara Azmi punya ni.
Lambat juga dia punya tu. Bunyi apa tu sial?
Dia patut aku boleh tengok ranking tu tau. Pasal aku tak boleh tengok.
Patutnya kau host kan?
Okay lah, aku terus sambung yang ni lah. Okay. Hi, welcome back with me you guys. I hope you all did well on quizzes. And congratulations to Raja Ikan, Yang, and Jo. And for the others, don't be sad. I'm sure you guys can do better next time. Alright, for the next presenter, please welcome Shamim and Shafiqah.
Hello, boleh dengar kan? Syamim tak ada tau. Aku cover dia.
Boleh. Please welcome Shafiqah. Okay.
Bismillahirrahmanirrahim. Sekejap aku share slide.
Proceed je Fika.
Okay, boleh nampak kan? Hello?
Ya.
Boleh.
Okay, so very good morning to all, and today we are going to talk about respiratory system. Most of us, my name is Nur Shafiqah Betruzan and my group partner is Muhammad Shamim Arif. So this is the table of content. We are going to talk about respiratory system disease and current technology to cure, and how to take care of our respiratory system. Okay, so first, what is the respiratory system? Okay, respiratory system is the networks of organs and tissue that help you breathe. It includes your airway, lungs and blood vessels. The muscles that power your lung are also part of the respiratory system. These parts work together to move oxygen throughout the body and clean out waste gas like carbon dioxide. So next, what does the respiratory system do? Okay, so the respiratory system has many functions. Besides helping you inhale and exhale, it also allows you to talk and to smell, warms air to match your body temperature, deliver oxygen to the cells in your body. It also removes waste gases including carbon dioxide from the body when you exhale. It also protects your airway from harmful substances and irritants. And next, what are the parts of the respiratory system? The respiratory system has many different parts that work together to help we breathe. Each part of group has many separate components. Your airway delivers air to your lungs. Your airways are a complicated system that includes our mouth and nose. Our mouth and nose are opening that pull air from outside your body into your respiratory system, and sinuses. Sinus is hollow areas between the bones in your head that help regulate the temperature and humidity of the air you inhale. Throat is the tube that delivers air from our mouth to nose and to the trachea. Trachea is a passage that connecting your throat and lungs. bronchial tubes. It has tubes at the bottom of your windpipe that connect into each lung. Lungs is the two organs that remove oxygen from the air and pass it into your blood. So muscle and bones help to move the air we inhale into and out of our lungs. Some of the bones and muscles in the respiratory system includes our diaphragm and ribs. Diaphragm is a muscle that helps our lungs pull in air and push it out. As we can see from the picture, we can see how it helps our lungs to pull in air and push it out. And ribs are the bones that surround and protect your lungs and heart. Next, when we breathe out, our blood carries carbon dioxide and other waste out of the body. Other components that work with the lungs and blood vessels include alveoli, bronchioles, capillaries, lung lobes, pleura. Alveoli is the tiny assets in the lung where the exchange of oxygen and carbon dioxide takes place. Bronchioles is a small branch of the bronchial tubes that lead to the alveoli. Capillaries is a blood vessels in the alveoli walls that move oxygen. Capillaries is a blood vessel in the alveoli walls that move oxygen and carbon dioxide. Lung lobes are section of the lungs, or 3 lobes in the right lung and 2 in the left lung. Pleura is the thin cells that surround each lung lobe and separate your lungs from the chest wall. This is the picture how the alveoli work. So the alveoli are completely covered in blood vessels or capillaries. The walls of the capillaries are extremely thin. O2 has no distance to travel to get into the blood. The alveoli increase the surface area heavily. Humans have about 300 million alveoli in both lungs, giving a total surface area of 80 meters square. Okay, so this is some of the other components of our respiratory system, including cilia, tiny hair that move in a wave-like motion to filter dust and other irritants out of your airways. Epiglottis, tissue flap at the entrance to the trachea that close when you swallow to keep food and liquid out of your airway. Larynx or voice box, hollow organ that allows you to talk and make sounds when air moves in and out. Okay, so this is the example of our respiratory system anatomy. And next is the respiratory system disease and its current technology to cure. Okay, so first we're going to talk about coronavirus disease. So coronavirus disease is one of the diseases that include respiratory system. Okay, so the COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease caused by severe acute respiratory syndrome. The novel virus was first identified in the Chinese city of Wuhan in December 2019. And signs and symptoms of coronavirus is a fever, cough, loss of taste or smell. So the serious symptom of coronavirus is difficulty breathing or shortness of breath. It also has a chest pain and loss of speech or mobility or confusion. So how the coronavirus spreads? Coronavirus spread caused by the droplet from an infected person cause sneeze or breath. They could be in the air or on a surface that you touch before touching your eyes, nose or mouth that give the virus a passage to the mucous membrane in your throat. Within 2 to 3 days, our immune system may respond with symptoms including this is how coronavirus attacks our lungs. So about 40% of COVID-19 cases are severe with an infection that affect our both lungs. As the swelling gets worse, our lungs will fill with fluid and debris. Okay, so the air sacs fill with mucus, fluid and other cells that are trying to fight the infection. This can make it harder for our body to take in oxygen. We may have trouble breathing or feel short of breath, and we may also breathe faster. So when we get the coronavirus, our swelling get worse, and the virus will fill our lungs with fluid and debris, and that will causes us to have a chest pain. Okay, next, okay, this is the example of a normal lung X-ray and a lung of coronavirus patient. So as we can see, this is a normal lung X-ray of a normal person, and this one is a lung X-ray from the coronavirus patient. As we can see, coronavirus patient lung is full with fluid. Okay, so next. Okay, so the current technology to fight coronavirus is ventilator. So a ventilator mechanically helps pumps oxygen into our body. The air will flow through a tube that goes in our mouth and down our windpipe. The ventilator also may breathe out for you, or you may do it on your own. So a ventilator doesn't cure COVID-19 or other illness that cause our breathing problem. It just helps we survive until we got better and our lung can work on their own. Okay, so next. Okay, so image below show how a ventilator used to treat COVID-19 patient. As you can see, ventilator, the tube will go through the patient trachea, and the ventilator will help the lungs to pumping oxygen. Okay, so next. Okay, so the second disease that include pneumonia is that include respiratory system is pneumonia. Okay, so pneumonia is a form of acute respiratory infection that affects the lung. The lungs are made of small sacs called alveoli which fill with air when a healthy person breathes. So when an individual has pneumonia, it will make our breathing painful and limits the oxygen intake. So pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than age 95, and people with health problem or weakened immune system. So next, okay, this is the sign and symptoms of pneumonia. Okay, we will get a chest pain when we breathe or cough. We will confusion or change in mental awareness. It usually occurs to the person age 65 above and older. Okay, so another sign and symptoms of pneumonia is fatigue, fever, sweating and shaking, lower than normal body temperature, nausea, vomiting or diarrhea, and shortness of breath. So the causes of pneumonia. Okay, pneumonia happens when germs get into our lungs and cause an infection. The immune system reaction to clear the infection result in inflammation in the lung air sacs. The inflammation can eventually cause the air sacs to fill up with pus and liquids, causing pneumonia symptoms. So causes of pneumonia is because of the virus, bacteria and fungi. So this is the example of several types of infection agents can cause pneumonia, including bacteria, virus and fungi. Okay, so next. Okay, so this is the current technology to cure pneumonia. So first, antibiotic. Mild pneumonia can usually be treated at home with rest antibiotic. Okay, so mild pneumonia can usually be treated just by antibiotic, and we should take a prescribed course of antibiotics. So second, we have bronchoscopy. Okay, so bronchoscopy is a procedure to look directly at the airways in the lung using a thin lighted tube. Okay, so the bronchoscope is put in the nose or mouth, like you can see in the picture. It is moved down the throat and windpipe and into the airways. A healthcare provider can see their voice box, bronchi, and smaller branches of the bronchi. So this bronchoscope is used to look at the windpipe. Okay, so there are two types of bronchoscope. Okay, we have two types of bronchoscope: a rigid bronchoscope and a flexible bronchoscope. A rigid bronchoscope is a straight tube. It's only used to view the larger airways. Okay, so a rigid bronchoscope is used usually to remove foreign object, control bleeding, and remove tissue. Okay, so this is the example picture of a rigid bronchoscope and a flexible bronchoscope. A flexible bronchoscope is used more often. Okay, so a, bron- a flexible bronchoscope can be moved down into the smaller airways. Okay, so this is the example picture of a flexible bronchoscope. It usually used to place a breathing tube in the airway to help give oxygen and put medicine directly into the lungs. Okay, so next. So we're going to the last section. Is how to take care of our respiratory system. Okay, so how can we keep our respiratory system healthy? Okay, so first, do not smoke. Avoid breathing second-hand smoke. Do not inhale harmful drugs. Eat a healthy diet. Exercise regularly. Prevent infection by washing your hands and avoid breathing polluted air. Okay, so this is the end of our presentation, and thank you. Do you have any question?
Next time, korang tak payah cakap do you have any question lah. Bagi aku yang cakap. Boleh Okay, tak apa. Aku pun tak mention tadi.
Habis tu terus thanks
Okay, kau habis cakap nanti okay, thank you, dan aku akan cakap thank you so much to Syamim and Afika. Nanti baru aku akan bagi tahulah open comment section. Kalau tak ada orang komen, aku akan tanya soalan. Aku dah bagi soalan kat kau kan?
Ada.
Sekali, okay. Thank you so much to Syamim and Afika.
Slide tu skip ataupun habiskan terus? Slide tu
kau dah habis kan? Kau dah habis cakap kan?
Dah habis tu stop terus lah. Okay, faham.
Slide tu biar je ada. Screen tu biar je ada. Yang thank you tu, part thank you tu. Lepas tu baru aku akan sambung lah. Okay, thank you so much to Syamim and Afika for the great presentation. Now I have aku akan buka question. Kalau tak ada orang tanya, aku akan tanya.
Kalau ada orang tanya,
yang part itu kena fikir sendiri lah kalau tanya.
Okay.
Kalau better baru aku yang tanya lah, sebab dah ada jawapan kan. Okay lah, yang part ni aku
Fikri isyak rokok ke?
Fikri, kau janganlah merokok. Okay lah, aku tanya for now, Najib, aku nak tanya, kau nak aku tanya soalan ke tak dekat diorang?
Tengok masa Faiz.
Itulah aku
kalau masa tak panjang,
kalau aku rasa
minit. Kalau tak ada masa terus jalan je.
Okay lah, for now aku skip dulu lah. Okay, thank you so much to Syamim and Afika for the great presentation.
Okay, thank you Faiz.
Okay, now we will continue our session. Please welcome our next presenter, which are Izzat and Hafizah. Izzat Farhan and Hafizah. You guys may start now. Thank you.
Fizul. Okay, Fizul can start now.
Dengar kak.
Assalamualaikum warahmatullahi wabarakatuh. Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Izzat Farhan, and my partner Muhammad Fizul. But I think Muhammad Fizul have a problem with the internet connection. I think I have to continue. Today our topic is reproductive system. Okay, what is reproductive system? Reproductive system is to ensure the continuation of the human species. Produce, store and transport gamete, which is a sex cells, gonad carry out cell to produce gamete. Number one, testis produce sperm, which is a male gonads. Number two is ovaries that produce ovum, which is female gonads. What is cells? Sex cells or gametes. Sperm is in male, ovum is in females. Gametes production slows when there is a reduction in sex hormones. For male is called andropause. For female is called menopause. Okay, this is the structure function for male reproductive system. There is testis, seminiferous tubulus, epididymis, vas deferens, seminal vesicles, prostate gland, and penis. Male reproductive system tract. Okay, number one is testis, epididymis, to vas deferens, ejaculatory duct, and urethra. Okay, next we to female reproductive system. What is female reproductive system? Is to production of gamete, which is ovum or eggs, preparation for support or of developing embryo during pregnancy. Cyclic change. Average 28 days. Complex interplay between hormones and organ at level of brain, ovaries and uterus. In female reproduction structure, there is ovary, fallopian tubes, uterus, cervix, vagina and endometrium. This is the structure function for female reproductive system. As we can see, there is ovary, fallopian tubes, uterus, cervix, vagina and endometrium. Reproductive system disease. Number one is infection. Number two is congenital abnormalities, cancers, and lastly is functional problem. Infection is caused by a bacterium, virus, fungus, and or other organism. Some infections are easily treatable and can be cured. Some are more difficult and some are non-curable, such as AIDS and herpes. Okay, number two is congenital abnormalities. There are three types of congenital abnormalities. Number one is Kallman syndrome, and number two is androgen insensitivity syndrome, and lastly is intersexuality. There are 7 types of cancers. Number one is prostate cancer, breast cancer, ovarian cancer, penile cancer, uterine cancer, testicular cancer, and lastly is cervical cancer. Functional problem. Number one is impotence, hypogonadism, ectopic pregnancy, female sexual arousal disorder, premature ejaculation, and lastly is dysmenorrhea. Okay, we come to the prostate cancer. What is prostate cancer? Cancer starts when cells in the body begin to grow out of control. Cells in nearly any part of the body can become cancer cells and can then spread to other areas of the body. Prostate cancer begins when cells in the prostate gland start to grow out of control. The prostate in a gland found only in males. It makes some of the fluid that is part of semen. The prostate is below the bladder and in front of the rectum. Just behind the prostate are glands called seminal vesicle that make most of the fluid for semen. The urethra, which is the tube that carries urine and semen out of the body through the penis, go through the center of the prostate. The size of the prostate can change as a man age. In younger men, it is about the size of a walnut, but it can be much larger in older men. Prostate cancer risk factor. The researchers have found several factors that might affect a man's risk of getting prostate cancer. Okay, number one is age. Prostate cancer is rare in men younger than 40, but the chance of having prostate cancer rise rapidly after age of 50. About 6 in 10 cases of prostate cancers are found in men older than 65 years old. Number 2, race or ethnicity. Number 3 is geography. The reason for these two factors are not clear. Lastly is family history. Prostate cancer seems to run in some families, which suggests that in some cases there may be an inherited or genetic factor. Still, most prostate cancer occur in men without a family history of it. Um, Factor with less clear effect on prostate cancer risk. Number 1 is diet. The exact role of diet in prostate cancer is not clear, but several factors have been studied. Men who eat a lot of dairy products appear to have a slightly higher chance of getting prostate cancer. Number 2 is obesity. Number 3 is smoking. Most studies have found a link between smoking and getting prostate cancer. So, who has a smoking habit? It is a good time to quit now. And lastly is inflammation of the prostate. Okay, can prostate cancer be prevented? There is no sure way to prevent prostate cancer. Many risk factors such as age, race and family history can't be controlled. But there are some things you can do that might lower your risk of prostate cancer. Okay, number 1 is eat more vitamin, mineral and other supplement. Number 2 is getting medicine. Number 3 is body weight, physical activity and diet. For now, the best advice about diet and activity to possibly reduce the risk of prostate cancer is to get and stay at a healthy weight. Number 2 is keep physically active. Number 2 is follow a healthy eating pattern. Prostate cancer can be treated from surgery. Number 2 is observation or active surveillance, radiation therapy, cryotherapy, hormone therapy, chemotherapy, immunotherapy and targeted therapy. Surgery for prostate cancer. Surgery is a common choice to try to cure prostate cancer if it is not tough to have spread outside the prostate gland. The main type of surgery for prostate cancer is a radical prostatectomy. In this operation, the surgeon removes the entire prostate gland plus some of the tissue around it, including the seminal vesicle. There are type of risk of prostate surgery, such as reaction to anesthesia, bleeding from the surgery, blood clot in the leg or lungs, damage to nearby organ and infection at the surgery site. And lastly is the side effect of the prostate surgery. Number 1 is urinary incontinence, such as stress incontinence, overflow, urge and continuous incontinence. And lastly is erectile dysfunction.
Sorry dah ganggu. Aku rasa kau kena pendekkan sikit lagi slide kau. Oh, dah habis dah? Lepas ni dah habis dah?
Dah habis.
Okay.
Thank you very much.
Thank you so much to our panel for interesting talks. Okay, actually I have one question. You guys already talked a lot about infection and functional problem for genitals. Can you guys give more example on how to keep your reproductive system healthy other than exercise and eating healthy? Can you guys give some insight? aku aku dah bagi jawapan dia.
Tanya sendiri, jawab sendiri
Dekat WhatsApp Izzat. Kan terus caw
Wah, habis terus pula.
Jalan Faiz.
Sambung je.
Ada lah.
Aku tanya soalan tu.
So kalau tak boleh jawab, kita sambung je ke?
Tak, aku bagi soalan dah sekali dengan jawapan dekat WhatsApp. So dia orang just baca balik jawapan dia je lah.
First, tak ada orang jawab kan?
Tak. Izzat, hello Izzat. Kau asal caw Izzat? Mana Izzat?
Jangan macam ni.
Nanti tanya dia caw macam tu kak. Gila.
Oi. Bahaya Mat.
Bahaya ni.
Aku dah WhatsApp Izzat, dia buat dia.
Izzat?
Weh.
Soalan.
Kau dah baca soalan, tak dengar tu.
Tak dengar. Aku sekat-sekat. Aku baca balik
Baca balik.
You guys already talked a lot about the infection and functional problems for genitals. Can you guys give more example on how to keep your reproductive system healthy other than exercise and eating healthy? Can you guys give some insight?
Okay, the question is how do you keep your reproductive system healthy? Right, Faiz?
Other than exercise and eating healthy.
Other than healthy lifestyle?
No, selain daripada bersenam dengan makan makanan yang sihat. Ada je jawapan dia. Baca je. Kecuali yang cakap je semua dalam teks tu.
Panjang sangat ni.
Tak apa. Aku takkan tanya soalan ni kalau ada orang yang ada soalan. Sebab sekarang kan main masa.
So aku baca yang bawah ni lah.
Kau baca yang bawah je. Kau cakap yang pasal stres, pasal STI, pasal lelaki tu. Ada yang yang 3 bawah tu je. 3 ke 4.
If you are a boy, you should always wear a protective cup when you play contact sports. Contact sports including football, boxing and hockey. Wearing a cup will help protect the testes from injury. You should also do a monthly self-exam to check for cancer of the testes.
Okay.
Girls should also get in the habit of doing a monthly self-exam to check for breast cancer. Although breast cancer is rare in teens, it's a good idea to start doing the exam when you are young. It will help you get to know what is normal for you.
Okay, thank you so much to that. Okay. Itu je kan? Dekat korang. Okay, and now okay. Ini energizer kan? Okay. Now we done with our fourth session, and now we will start doing a little energizer. So to keep you guys still to keep you guys week. I know you guys are bored and tired and listening to all this stuff. Okay, now we will start our energizer. Siapa handle energizer? Azmi kan? Aku start ke?
Tak okey je.
Okay je Faiz, tak ada masalah. Jangan risau.
Mana JK Jenizer?
Azmi tidur lah tu.
Azmi, Pemajan.
Kalau aku terus siap boleh lah.
Buka je video tu.
Azmi tertidur
Buka je video tu.
Ni Jan ada, Jan ada.
Pak Majan ada?
Nah, ni Pak Majan ada ni.
Dengar tak korang?
Ni. Buka.
Kena aku buka.
Buat sikit-sikit dah lah.
Buka le, orang nak tengok masa.
Nampak tak?
Kepala batu, lutut kaki.
Nampak tak korang?
Silakan Muhammad Najib.
Tak ada apa Pemajan.
Aku dah buka
Pak Nazir.
Mana lagu?
Weh, belakang apa tu?
Ni dah record. Tan dah record dah.
Lagu.
Begini mana?
Kau lagu mana? Lagu ah?
Screen tak ni.
Buat dah.
Siapa yang lead lah benda exercise ni? Azmi kan? Kau lead kan? Okay. Thank you to Azmi. Nanti kau lead Azmi. Kau lead benda ni kau lead kan. Kau lead sekali. Okay, thank you to Azmi. And now I feel a bit energy. I feel like blah blah. Aisyah cakap. Okay. We will proceed our presentation now. Please welcome Farah Zahira and Nur Aina.
Assalamualaikum to my friends, teacher and audience. So today I would like to present a topic about urinary system. My name is Fazira bint Ashari and my friend is Aina Fifa bint Muhammad Dasuki. Okay. So today we like to talk about introduction of urinary system, common disease of urinary system, current technology to cure, how to take care of our kidney. So what is introduction of urinary system? The urinary tract begins at the kidney, which are the two bean-shaped things. The kidney are organs the size of your fist that sit under your rib along your back. Kidney filter blood to remove waste. The waste and extra water combine to make urine, which is also called a pee. After the kidney is pretty much just pumping. The urine enters two small tubes, one coming from each kidney. These are called the ureters. They lead to the bladder. The bladder is the sac that holds the pee. When it's time to go to the bathroom, the smooth muscle of the bladder constrict to push pee into another tube called the urethra, which carry the pee out of the body. So this is how the process in urinary system. So what is different between female and male in urinary system? Male has a long urethra than female. It is because the male urethra extends through the penis. The only function of the female urethra is to transfer urine from the urinary bladder to the external space. But in males, urethra is involved in transporting urine from the bladder to the external space, as well as the integration of semen fluid through the urethra. Unlike in female urethra is considered as a part of both urinary and reproductive system. Urinary infections are more common in female than in male. So the common disease of urinary system. So the first is benign prostatic hyperplasia, cancer of benign tumor, infection of the urinary tract, kidney disease, kidney or urinary tract stone, and polycystic syndrome. So the first common disease is kidney stone. So what is a kidney stone? Usually your kidney remove waste from your blood to make urine. When there is too much waste in your blood and your body is not producing enough urine, crystals begin to form in the kidney. This crystal attract other waste and chemical to form a solid object, which is a kidney stone. That will get larger unless it is presses out of your body in your urine. Kidney stone can be as small as a grain of sand or as large as a golf ball. So the cause of the kidney stone. You have had kidney stone before. You don't drink enough water. You are overweight or obese. You follow a diet high in protein, sodium or sugar. So the type of kidney stone is potassium oxalate, uric acid, graphite. So the symptom of kidney stone is one. The center of kidney stone is 7 pens on either side of the lower back, nauseous or vomiting, urine that smells bad or look grounding, and fever. So the treatment of kidney stone is extracorporeal shockwave electrotherapy. So we call it shockwave. This treatment uses shockwave to break up the kidney stone into small pieces. After the treatment, the small pieces of the kidney stone will pass through your urinary tract and out of your body with your urine. This treatment usually takes 55 minutes to 1 hour and may be done under general anesthesia, which means you will be asleep and unable to feel pain. This treatment depends on your kidney stone. If your kidney stone is small, doctor will give you a pain medic and drink plenty of fluid to help push the stone through your urinary tract. But if your kidney stone is larger, maybe you have to get shockwave to break up the kidney stone. So that's all for me. So I will pass this to Aina to continue this topic.
Assalamualaikum and very good evening to my fellow friends. From now on, I will continue about the urinary system. I will explain about urinary tract infection, which is what is urinary tract infection, urinary tract infection system, and also urinary tract infection treatment. What is urinary tract infection? Urinary tract infection is also known as UTI, where U stands for urinary, T for tract, and I for infection. UTI are caused by microbes such as bacteria overcoming the body's defense in our urinary tract. They can affect our kidneys, bladder, and the tube that run between them. They are one of the most common types of infection and account for around 8.1 million trusted source visit to a doctor every year. UTI can be divided into the upper urinary tract and the lower urinary tract. The upper urinary tract consists of the kidneys and the ureters, and the lower urinary tract consists of the bladder and the urethra. The vast majority of UTI are caused by the bacterium Oli, usually found in the digestive system. Next, Farah. Urinary tract infection system. Okay, the system of UTI can depend on our age, gender, and also the presence of our catheter and what part of the urinary tract has been affected. Okay, common system of a UTI include strong and frequent use to urinate, cloudy, bloody or strong smelling urine, pain or burning sensation when urinating, muscle aches and abdominal pains. Next, Farah. Okay. What is urinary tract infection treatments? As UTI are normally caused by bacteria, they are most commonly treated by antibiotics and antimicrobials. The type of medication and length of treatment will depend of the system and medical history of the individual each. Okay. Drinking a lot of fluids, frequently urinating are always recommended for people who have UTI, which this will help to flush out of the bacteria. A variety of pain relief medication may be prescribed to alleviate pain. And applying a heating pad to the back or our abdomen can also help. Then a complicated UTI is one of the occurs in a person who is weakened by another condition, such as pregnancy or heart transplant. And a complicated UTI tends to require longer period of antibiotic. Usually it will take between 7 to 14 days. Meanwhile, an uncomplicated UTI is one that occurs in an otherwise healthy person with a normal clear urinary tract. This can usually occur with 2 or 3 days of treatment. Next one. Okay, I will explain how to take care of our kidney. First, we must drink plenty of fluids. In general, we should drink fluid based on our weight. Water in liters to drink a day equals to your weight multiplied by 0.033. For example, if your weight is 60 kilogram, you should drink about 2 liters of water every single day. Okay. Keep active and fit. You must work out at least 5 times per week. You have to control your blood sugar. You must monitor blood pressure. And also you must monitor weight and fat, and also have a healthy diet. And don't smoke. Okay. Be aware of the amount of UTC pills you take. What is OTC pills? OTC pills is over-the-counter medicine or non-prescription medicine. All these terms to medicine that you can buy without prescription at the such as at the hospital or pharmacy or clinic. They are safe and effective, but when you follow the direction on the label and as directed by your healthcare professional, but it may also cause have bad side effect. And the last one is have your kidney function tested if you are at high risk. Thank you. That's all from us.
Okay, thank you so much to Farah Zuhaira and Nur Aina for the amazing talks. Now we will open comment section for the audience to ask any questions to them. Blah 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 blah. Okay. I'm sure you guys are already tired listening to all this talk, but we have one last presenter to go. And please welcome Azlano and Muhammad Shahmi.
Okay, thank you to Faiz as our moderator of this program. Hello and good morning. After all, group explain the subtopic for anatomy, and now I will explain. I will continue our lesson about endocrine system. First of all, I introduce myself. My name is Azlano and my groupmate Shami. In this session, we will give explanation about thyroid and parathyroid. Okay, let's watch this video.
The thyroid gland is a butterfly-shaped gland in the center of the neck overlying the trachea or windpipe. There are 2 lobes on either side of the windpipe and a centerpiece called the isthmus, as well as the pyramidal lobe, which is a little finger of tissue that extends up towards the head in a certain percentage of patients. The parathyroid glands sit posterior or behind the thyroid gland, and here you can see the superior and inferior parathyroid glands, and these small glands are about the size of a grain of rice and sit typically on either side of the tubercle of the thyroid, as you can see here. In a good percentage of patients, the parathyroid glands may be in abnormal locations, or what we call ectopic locations. The upper parathyroid glands can sit anywhere from high up in the neck to all the way down into the chest, and most commonly, when they are in an abnormal position, lie in the tracheoesophageal groove, or the space between the trachea and the esophagus. During the development of the thyroid and the parathyroid glands, the lower parathyroid glands travel a further distance, so they are more often in ectopic or abnormal locations, and those locations are in more varied positions that range from high up in the neck, all the way down into the chest, as well as laterally or to the sides of the neck. The thyroid.
Okay. What is endocrine system? As you can see here and in my slide, the endocrine system is a messenger system comprising feedback loops of the hormones released by internal glands of an organism directly into the circulatory system, regulating distant target organs. Okay, or the endocrine system also is a collection of glands that secrete messaging chemicals known as hormone. These hormones travel through the bloodstream to the target organs and produce chemical exchange in the body. Okay, which means it is important to ensure that the human body has a very organized and balanced system. The endocrine system is among a relatively complex system in the human body. Okay, in human body, the major endocrine glands are the thyroid glands and the adrenal glands. Okay, its function is to release the hormone, regulate blood sugar level, blood pressure, reproductive system, and temperature. Okay, these hormone glands, endocrine glands associate hormones and their effect. Okay, as example, pituitary growth hormone and prolactin, which is growth of the body tissue and milk production. While thyroid is calcitonin, reduce blood calcium level. Parathyroid associated hormone is parathyroid hormone, increase blood level. Adrenal, aldosterone, increase blood levels also. Pancreas, insulin and glucagon, which is glucagon is sugar, reduce blood glucose and increase blood glucose. Testis, testosterone, and ovary, estrogen and progesterone, like group 4. Group 4 explained just now. Okay. Okay, I will explain about thyroid only. Okay, from the previous video that shown above, what we understand about thyroid gland is the thyroid gland is a butterfly shape that placed on the center of our trachea, or other name is windpipe. What is the use of trachea? Like my friend explained just now, Nurul Syafiqah, trachea is like a pipe shape of our breathing system. Okay, back to the thyroid. There are two lobes, which is right lobes and left lobes. At the center is called isthmus. The thyroid gland is located below the Adam apple, which is halcome, and right around the trachea. Okay, at the behind of the thyroid, you can see it has 4 points on the upper side, two on the upper side and 2 on the lower side. On the upper side, it called superior parathyroid glands, and the lower is inferior parathyroid glands. My friend Syami will explain about it after this. Okay, this is this thyroid disorder. There's several type of disorder, which is hypothyroidism, hyperthyroidism, goiter, thyroid nodules, and thyroid cancer. On the right slide, you can see in the picture the difference between the normal thyroid, hyperthyroidism, and hypo. Okay, the normal thyroid shape is a perfect shape, butterfly shape. Okay, while hyperthyroidism, the gland become bigger, while hypo is become smaller. Okay, thyroid disorder. Also, this is a healthy thyroid, and the second one is thyroid cancer, where they have a bubble, white bubble. On the right screen, the woman get the hyperthyroidism because you can see her neck become bigger. Okay, how to treat? Okay, standard treatment for hyperthyroidism involve daily use of the synthetic thyroid hormone levothyroxine. Okay, there is three treatment: water treatment, levothyroxine, and magnetic resonance imaging. Water treatment basically who get a hypothyroidism, so doctor will give the will suruh patient tu drink more water. Okay. The second one, the levothyroxine, is the pill, and magnetic resonance imaging for the patient who get hyperthyroidism. Okay. So parathyroid disorder, I will give to Shami to explain the parathyroid. Okay, Shami.
Okay, thank you Azlan for the explanation about thyroid gland. So my name is Muhammad Shami, and I am going to talk about parathyroid gland. So parathyroid gland is a type of endocrine gland that is in the upper and lower poles of the thyroid gland. So parathyroid disorder leads to abnormal levels of calcium in the blood. So parathyroid disorder, basically parathyroid release parathyroid hormone, and it contains calcium in the blood. So if the calcium was not on the normal level, it will cause some effect to our system. So parathyroid glands are usually was in 3 to 5 millimeter in diameter and 30 to 60 milligram in width. So it is usually as big as a grain of rice. So we can imagine just how big the parathyroid gland is. So next. So parathyroid disorder. Firstly, it is primary hyperparathyroidism, which results in hypercalcemia, which is calcium level in our blood is above normal, and we will sustain weak bones. Next, it is a secondary hyperparathyroidism, which is low calcium levels in our blood cells. Thirdly, it is the hypoparathyroidism, which is condition characterized by the decreased levels of parathyroid hormone. And lastly, it is the parathyroid carcinoma, which is quite rare to be happen, but it is usually occurs caused by the parathyroid adenomia. Okay, I am going to talk only about the hyperparathyroidism. So primary hyperparathyroidism is easier to diagnose, as we can take our blood and diagnose our blood, so we can check whether our calcium is above normal levels or it is decreasing. So the hypersecretion of the hormone results in hypercalcemia and weak bones, and it can be detected by an increased level of calcium ions in the blood. So we can see either we had hypercalcemia or secondary hyperparathyroidism in our case. Okay, next. Okay, this is the flow of primary hyperparathyroidism. On the first picture, we can see that the parathyroid cells is in normal condition, which nothing happens. And on the second picture, one of the parathyroid cells become abnormal. So one of the cells the calcium level in the cell is increasing. So on the third picture, the parathyroid cells grows more and affecting more of the cells surrounding them. And lastly, it will cause the parathyroid tumor. Okay, next. Okay, this is the device that will be used in the operation, which is the 4D CT, which is called the 4-dimensional computed tomography. Okay, on the right side of the picture, we can see that the parathyroid releases calcium, and it will be affecting on the side of the parathyroid. So during the operation, we can see that which part of the parathyroid is affected. Okay, that's all.
Okay, so that's all from us. If you have any question, you can ask. So thank you.
Thank you so much to Azlan and Syami. Okay, kalau tak ada soalan from audience, aku akan tanya soalan lah. Jawapan ni pun dah ada kan, so tak apalah. Sekarang pun masa singkat, so aku akan skip part tu. Okay, now we come to the part for the final Q&A. For those audience that didn't have a chance to ask the presenter for question, you guys wanted to ask, this is your time. The comments are open for you guys to ask any question. Alright everyone, now we have come to the end part of webinar. I would like to say thank you so much again to our presenter for the informative and interesting talk, and also the audience for active participation. Hopefully all the presentation will be beneficial for everybody. Before I sign off, in the comment section will be given a link. The link is for the audience to leave some review about this webinar and also to give rating and voting for the best presenter. Thank you again for all your attention. I am your moderator signing off. Okay, ni Pak Aisyah. Okay, thank you for all the speaker and moderator. Our webinar has come to the end. On behalf of all BEU 3A students, I would like to thank Madam Ida and all the lecturer and student for spending their time to join our webinar. Before, okay, and for now, I would like before we end this webinar, let's take a few pictures. But do not okay, and then please you guys do not leave after taking the picture, because link for attendance and certificate will be given by Adiba. Oh, Aisyah datang lah. Okay, you guys please open your camera. Aisyah boleh sambung kot part ni. Aku tak ada skrip ni.
Dah macam tu je. Sebelum tadi tu kita akan umum pemenang untuk ni lah, best presenter dengan best, kita ada dua je kan anugerah kan, best presenter dengan best content kan.
Kita ada dua.
So before ambil gambar tu lah, now we'll announce the winner for the best presenter and the best content. Lepas tu ada lagu ke Atin? Tak boleh Atin. Lepas tu dan ambil gambar.
Jap.
Thailand 4-0, see you.
Pasangkan tim. Asli. Dia ini ke dia punya lagunya?
Betul kau nak lagu apa lagi? Ini.
Okay, sekali lagi. Okay, now I will announce the best presenter for this webinar.
Announce.
Ahmad Najib.
Yay!
Lepas tu, next, the winner for the best content is Okay. Now let's take some pictures and please wait after we taking the picture because we're going to give the link for the attendance and certificate. Lepas tu okay, let's take picture. Lepas tu ni yang tu ambil gambar. Please open your camera. Lepas tu now Adiba will be given the link for the attendance. Diba, masa ni kau nak bagi link ke kau nak bagi juga QR code?
Dia 2. Nanti aku bagi Atin QR code tu. Terus masuk dekat dalam slide ni.
Nanti aku letak dalam slide. Tiba nanti bagi link tu dekat aku.
Ni tahu apa? Double order.
Pakai.
Sebab aku nanti nak bagi dekat wakil kelas tu.
Teacher, lepas tu if there are any problem
sekarang cik, kan kau bagi sekarang ni baru bagi sijil.
Apa?
Jangan kau bagi sekarang.
Nanti aku bagi.
Alright.
Masa nak dekat majlis ke?
That's all from us. Thank you.
Lagu Atin.
Nak lagu apa pula?
Okay, hari tu yang Fairul cakap yang Puan cakap best content tu tak payah.
So best presenter je. So best presenter je. Best presenter je lah.
Untuk presenter pilihan je.
Okay. Satu je lah.
Satu je lah. Best, lepas tu kan nak tanya best presenter tu dia ikut grouping ataupun seorang?
Individual.
So dalam voting tu kena tulis nama seorang-seorang lah punya presenter?
Dengan group, dengan apa tajuk yang dia present.
Okay. So maksudnya seorang je lah pemenang dia?
The best presenter je lah kan?
Okay.
Semua nanti ambil gambar kena buat macam ni.
Kau ingat kau YB ke?
Yelah, at least kita YB buat kerja lah sikit.
Adik, cuba kau tutup background kau. Kau tengok orang belakang kau.
Semua berkopiah, risau lah.
Dah habis ke? Ada apa-apa ke Najib nak cakap?
Najib, rap lah ni. Dah
Najib,
habis lah.
ya. Ada apa-apa ke nak cakap?
Ada.
Okay, beri peluang Sarah.
Sarah. Muka Syukri tu sikit lagi, dia tak berdampur.
Janganlah macam tu. Cuma nak tegur je. Yang slide tadi korang buat memang nice gila, padat. Lepas tu kan content dia memang best lah. Aku tengok kan macam-macam slide, macam kreatif lah apa semua kan. Tapi kadang-kadang macam cara present tu korang kena buat eye contact tau. Buat eye contact, jangan macam terlalu baca skrip sebab benda tu akan macam buat audience macam bosan. Macam tu lagi pun sebab benda ni macam markah korang punya speech juga tau, informative speech. So benda tu akan effect markah korang sebab korang baca yang scripted. Macam tu lah, faham tak? So kalau boleh
Lepas tu sebut tu macam sebut satu-satu perkataan. Tapi jangan sebut slow-slow je. Tapi jangan slow sangat. Faham tak? Macam tu lah. Macam lepas tu macam contoh kan, Faiz tadi moderate memang nice gila lah. Faiz moderate kan. Tapi kalau boleh macam apa, tone tu hype sikit. Faham tak? Macam hype sikit tone tu.
Faham. Betul. Nak bagi orang lagi tertarik.
Faiz kan lagi satu kan, suara tu janganlah suara bangun tidur.
Sebab macam aku dengar suara kau, aku rasa macam nak tidur je macam tu. So macam kalau boleh macam hype sikit.
Hi, welcome. Macam tu.
Macam tu. Macam Aisyah bagi MC kan macam sorry dia macam kuat macam tu kan.
Kau kena periang.
Boleh.
Macam tu lah. Lepas tu
Boleh guys. Boleh.
Macam tu. Lepas tu macam mana slide tu korang present tu pastikan 15 minutes, tak nak lebih. Sebab kalau lebih benda tu akan mengganggu tentative program. So macam pandai korang lah timing, sebab tak nak lah macam lebih kan nanti makan masa pula. And kita pun dah bagi VIP semua masa yang ditetapkan. So dorang pun sibuk and dorang squeeze time dorang untuk join program kita. So pandai-pandai timing lah, letak timer kat tepi. Tapi tadi korang present semua dah nice lah. Macam tu lah. Tapi overall okay kot, okay je. Okay, aku tengok semua tadi okay. Boleh ni. Tu je kot. Najib ada apa-apa ke nak tambah?
Satu mulai. Tak ada kot. Tapi itulah yang macam present lama tu lah, yang tu macam tak nak elak lah. Tapi kalau boleh slide tak perlu panjang kot.
Kalau jadi tu sebab diorang baca skrip kot. Kalau macam korang faham apa yang korang nak present, rasanya okey je. Macam aku rasa terangkan ringkas pun tak apa kot. Kalau tak baca skrip lah.
Sebabnya Alan dah tanya madam itu, kita boleh terangkan kod Melayu.
Kod Melayu.
Ikut Melayu. Kod Melayu sebab
Sebenarnya kalau korang nak macam korang just letak point and then korang explain lah dalam bahasa Melayu. Kalau korang tak macam susah untuk explain dalam bahasa Inggeris, so macam okey lah kat situ untuk orang dengar. Maksudnya macam lagi better, macam orang lagi menarik perhatian lah macam tu.
Kan
diam pasti kalau boleh avoid baca skrip sebab macam benda ni kan macam tak silap aku semua orang share markah kan. So macam kalau tu macam rehearse lah sikit, kesian-kesian lah kat member lain yang macam mencuba juga kan. Okay.
Mak terkejut aku.
Korang boleh, aku yakin.
Korang boleh. Ya, korang
kita
boleh.
Mantap lah Amir.
Apa Syuk, kita buat Jumaat depan petang 2:30.
Kita buat webinar ni ke? Petang?
7 hari bulan 1, 2:30 hingga 4:30.
Good evening. Afternoon. Pandai ke?
Confirm. Nanti kau bagi dia punya apa? Penyertaan ni apa panggil? Jemputan tu.
Jemputan dia jangan lupa Syuk. Tukar tarikh. Nanti aku tukar tarikh.
Dia bukan dah okey ke? Ke ada masalah lagi?
Puan apa yang join?
Puan apa yang join? Dengan puan apa yang ada masalah untuk join?
Satu lagi.
Itu tak selesai lagi masalah kau Syukri. Daripada hari itu.
Ada ke tak sebenarnya ni?
Sorang
Aku sebab aku yang nak cakap.
Diamlah semua. Diam.
Macam ni, nak confirmkan Syukri kan, aku nak confirmkan lecturer mana yang masuk sebab itulah sebab nak letak nama dia satu. Lepas tu kalau boleh macam kan kita kan nak cari satu lecturer yang akan bagi speech kan. So aku nak macam kira kau kena confirmkan kalau betul lecturer tu nak bagi speech. Puan cakap lecturer tu kena bagi dalam English jugalah sebab kita dah buat majlis dalam English. So diorang pun kena cakap English juga. And orang yang cakap tu kau kena confirmkan betul-betul dia punya pangkat tu apa. Sebab macam Puan Ida Maria, dia cakap Puan Department of DU, Puan Ida tu.
Puan kata better ambil Puan Huda sebab dia department BU kan. Sebab kita BU. So better ambil Puan Huda lah. So kau kena tanya.
Kena confirmkan lah Puan Huda tu boleh ke bagi speech dengan kena bagi tahu dia kita bagi speech dia dalam English lah. Macam tu je. Itu je. Kalau untuk orang lah.
Settlekanlah sebelum hari Rabu minggu depan ke Syukri sebab nak kena buat benda lain lagi.
Itulah aku cuma nak tanya bila boleh confirmkan je.
Aku rasa kau confirmkan ni je, lecture yang ni je lah yang penting tu.
Boleh Syuk?
Yang tertinggi tak lah maksudnya.
Okay.
Saya Syukri hilang.
Syukri?
So, untuk esok dulu aku back Jumaat aku ada kerja sikit. Ahad aku ada tengoklah aku range masa ke sini nanti.
Dah tu korang.
Dah tu.
So far okay kot. InsyaAllah kot boleh kan? Tak payah raptai lagi kan ke korang nak raptai lagi? Tak perlu.
Korang Najib.
Nak kena tanya yang presenter perlukan raptai lagi ke tak?
Najib kalau guna training sendiri kot.
Yang apa tu, yang semua yang terlibat tu sporting lah sikit kan. Jangan main phone.
Kan lah sport.
Nak sporting.
Sporting.
Siapa nak sporting? Bantai lagi lah.
Siapa tu?
Sebab tu.
Masa present.
Korang ada majlis agama ke kopiah putih?
Kau yang macam ni lepas solat maghrib insyaAllah dia dah scroll sikit.
Oh, maghrib je lah.
Isyak dah nanti. Baru maghrib.
11 maghrib je.
Betul lah maghrib tak sekirah lepas isyak al-mu. Astagfirullahaladzim.
Cicak berak.
Isyak 12.
Tak habis lagi. Ya Allah, tadi kan ada present masing-masing. Pukul 9 kan masuk.
Ya Allah. Sedapnya dengan suara Najib ni.
Aku rasa macam munafik sangat.
Allah kan.
Mengaku sendiri tak apa.
Majlis
Mengaku
kita
tak
pada
apa.
malam ini. 11 dah ni.
Dah habis kan? Dah boleh tutup ke?
Adik.
Yang lain yang
lain ada apa-apa nak cakap ke?
YouTube tu tak ada masalah ada ke?
Okay.
YouTube dah cantik tadi. Tengok.
Apa kalau ada masalah PM tepi je, okay?
Satu lagi apa ni slide tu. Slide tu rasa macam banyak sangat teks tu, kecil-kecil kan, buangkan lah.
Betul.
Amir nak cakap ni. Amir.
Oh.
Kenapa kau punya slide tiba-tiba first kali tiba gambar bontot orang? Kau tak ada gambar lain ni nak letak?
Dah tukar. Aish. Gambar masjid. Kami dah seberat suara tadi. Gambar pantis. Itu gambar
Azmi tak kasi Najib.
Azmi ada tapi dia Azmi buat grab dalam keadaan kritikal sekarang.
Nak tanya sebab nak confirmation daripada dia dengan Pak Majan yang untuk energizer tu nanti siapa yang nak buka kan kalau tiba-tiba
quizzes tu jadi ke buatnya?
Dah buat dah tadi Aisyah.
Buat
bulan yang kali masuk.
Tak, quiz tu okey lagi. Energizer lah. Energizer tu nampak macam krik-krik sikit.
Agak.
Satu lagi background slide tu kan. Kalau korang macam contoh moderator kan, korang nak buat custom punya background. Letak moderator atas dia pun comel juga.
Macam mana Aisyah tu?
Tak faham.
Background tu kalau nak buat custom sendiri, contoh je korang MC, letaklah MC atas kepala.
Tak apa, nanti aku pakai crown tunjuk MC.
Boleh juga.
Tak nak. Nanti macam nampak.
Satu lagi yang untuk slide tadi, Alan dah ni ke Lan? Ajar yang pasal buat slide tu betul kan? Alan OTP. Lan?
Slide apa?
Mana pula OTP dengan girlfriend masa ni?
Aisyah kata dengan orang.
Kenapa? yang kita boleh control slide tu.
Tadi aku rasa sekejap.
Sebab macam tak buat design tu.
Itulah. Show off tak baik.
Sebab tadi masa aku present, aku nampak macam ada satu bar kat atas tu.
Ada yang tak ada. So mostly betulkan yang tu dulu kot. Tu lah yang tak nampak lagi. Yang lain
dekat mana ni?
Yang itu okey lah.
Oh, tak apa, nanti kita tengok macam ni. Kalau ni lah, aku nak pakai lah kan.
Tak nak pakai ke macam mana?
Setakat ni macam okey lah. Setakat ni tengok masing-masing slide present okey je. So tak payahlah kot.
Ikut majority lah. Aku tak boleh nak beri sekarang. Macam dah hilang otak.
Hari ni macam semua line okey, macam tak ada yang pelik-pelik. So aku rasa nanti okey semua. Jadi korang nak pegang sendirilah slide tu kan? Pegang sendirilah.
Nampaknya macam tu lah. Setakat ni okey je. Maintain lah kot.
Tak apa ya.
Dah. Kalau tak ada apa-apa, boleh disband kot. Okay. Bye-bye. Terima kasih.
Asha bye.
Bye.
Terima kasih semua. Terima kasih.
Semua.
Fatihah.
Fatihah buat macam ni.
Lagi sekali mai. Mantap mai.
Bye semua. Thank you. Sorry tak nak join awal.
Bye semua.
Dah lewat ni, lewat malam. Tak baik.
Rak lu.
Dah bye.
Bye.